All right, so we're looking at some other issues. Okay, types of synovitis. So synovitis is simply what? Inflammation of the synovium. Okay, so this one is known as the acute atraumatic synovitis. So it's usually a problem in adults. Okay, acute atraumatic synovitis. So this just refers to what? Sudden inflammation of the synovial membrane in the joint, and there's no history or there's no previous history of trauma. Okay, so it's usually secondary to what? Systemic conditions, like autoimmune disease, infections, or crystal deposition. Okay, so key features of this acute atraumatic synovitis is there's inflammation of the synovial membrane, which is lining the joint, and this is now producing excess synovial fluid, and it's causing a lot of pain, a lot of stiffness. So it's usually sudden, all of a sudden, without what? A previous history of trauma or mechanical injury. Okay, so symptoms: there's a lot of pain and tenderness in the joint, there's swelling and warmth, there's reduced range of motion, there's stiffness, especially after a rest for a very long time. Okay, so major causes in adults could be what? Autoimmune or inflammatory conditions like all those rheumatoid arthritis, lupus, psoriatic arthritis. Could be due to crystal deposition, could be due to infection, viral infections, could be due to what? Bleedings in the joints. Okay, but sometimes the cause is not known. Okay, so diagnosis from you are trying to access how there's swelling, how there's tenderness, how there's warmth, how there's mobility. They do lab tests to now look at all those inflammatory markers, also all those markers to indicate if there's an infection. So joint aspiration too. You're trying to culture the joint, you're trying to access if there's crystals in it. Then imagings like x-rays and also ultrasound. So management, you have to rule out septic arthritis first. So make sure that there's no infections, Then if there's no infection, use NSAIDs to relieve the pain. The person should rest and stop using that joint like they used to. Ice packs if there's swelling, and also corticosteroid injections.